Hello, my name is Mitchell Greenbaum. I'm the OB-GYN Residency Program Director for Mercy Health here in Toledo, Ohio. Currently, we are ACGME certified in our initial accreditation phase, which began in 2017. Our goal is to prepare our graduates to handle all levels of patient acuity. We are a Level 4 regional transport center located in Toledo and manage all levels of gestational age patients. Our residency difference from most is our residents are both friends inside and outside of work. This lends to a lower stress environment, a better health environment and well-being for our residents. We have a buddy system which ties our PGY1 residents to one of our senior residents for his first 3 months. This helps the PGY1 residents acclimate to the program easily and lowers their stress level throughout the initial 3 months of training. Our residents get early access to gynecologic surgeries. They get exposure to robotics and minimally invasive surgeries early on in the program. This differs from most residency programs.
Typical day starts, if I'm on OB-GYN labor and delivery, then I would go to sign out on the floor. We have a group sign out. That's about 7 a.m. We go over all the patients that are on the floor, all the antepartum patients and any surgeries that might need covered that day. From then I would go to cover the floor all day until sign out again around 5:15 p.m. If I'm on labor and delivery. If I'm on a GYN service, then I'm going to be covering cases, so I would head to pre-op, see my patients, round on them before they go to surgery, and do the surgeries throughout the day, post-op them, and make sure that they're okay in recovery if they're going home, and discharge them from there. Those are typical days if you're just doing labor and delivery and GYN.
In our program, we have a dedicated simulation center that is extensive. We also have dedicated research coordinator and ultrasonography program.
When I was a student here, I did a 4-week rotation and auditioned. I immediately fell in love with the program. It was immediately evident that it was a family here. The residents are a very close, tight group. We work hard, we support each other, we have fun inside and outside of work. It's a great working environment with the attendings. They're very supportive, they have a lot of passion for our education. And also another big reason besides the people is I chose this place because it was a great opportunity for our education. You see everything here, both obstetrics and gynecology. It's just it's busy and it's a great opportunity for learning.
The hospital as a whole makes relocation very easy. They do give you a stipend of money to help with that process of moving, and you can spend that money obviously on anything that goes into moving. So you can use it for a moving truck, you can use it for even just boxes for packing. Moving here was an easy process. The city itself is a nice city to be at because it is not a large city atmosphere. It's very easy to get around everywhere. Everything's about 15 minutes away from each other. There's never any problems with parking. It's just an easy place to navigate, and you're very close to large cities, so traveling is very easy as well.
Our program is happy to state that we have a 100% board passage rate and a 100% job placement rate. We welcome you to St. Vincent's Mercy Medical Center for the OB-GYN Residency Program.